I see the effects of marijuana in the emergency department a lot. So I'm very clear that it's not harmless. It really depends upon, again, how early you start using it and how frequently you use it. It's normally short-term memory problems, decrease in people's IQ, problem solving. It would look like an early dementia.
She blinded me with science. She blinded me
Marijuana has gone from controversial to completely normalized fast. It's in gummies, drinks, oils, marketed for sleep, anxiety, recovery, even focus. And CBD in particular is often seen as the safe version. But here's the reality. Just because something is legal or widely available doesn't mean it's risk-free or even well understood in this case. And what we often don't hear about is what's showing up on the clinical side of things. Today, on What the Health is Happening, we're talking about marijuana versus CBD, what they actually do, how different formats affect the body, the difference between medicinal and recreational use, and some of the very real issues being seen in the ER. Not to scare you, but to give you a clearer, more informed lens. We're here with Dr. V on What the Health is Happening, and I'm so excited to see you again and have this great conversation. How are you feeling today? Are you excited for this?
I'm doing great. Yeah, I'm doing great. I'm excited about this conversation.
Awesome. Yeah, I think that is a really important conversation to have. Like we chatted about, it's becoming super normalized and common. There's dispensaries all over the place, and so many people think they're the same thing. I mean, myself, for one, I don't know the difference. So I'm excited to learn about this today.
Yeah.
So let's hop into that on that note. So marijuana and CBD are often lumped together in conversation, right? But they're really not the same thing. So can you walk us through the fundamental difference between the two?
Yeah, so they're often lumped together because CBD can come from marijuana or it can come from hemp, right? But CBD is not psychoactive. So there's no high that you get from CBD. The other thing that's important is CBD actually is federally approved in all of the states. Marijuana is psychoactive. The psychoactive component of marijuana is THC. And it will give you a high. And marijuana is not approved from state to state. So they are both very, very different.
And today I know they come in so many different forms at
Yeah.
this point.
Yes.
It's like every time I leave my house, I feel like I see an ad or something for a different format, right? So
Right.
cookies, gummies, drinks, even vapes, lotions too, as hemp lotion, CBD lotion. But how does the format change the risk profile and how the body responds to it?
So it's interesting because it's really all about how much of the active ingredient is actually in that particular gummy or drink or whatever it may happen to be. So when you look at like THC products or marijuana products, you can have 2 milligrams or you can have 50 milligrams or more in a gummy or a cookie or a drink. So it's really about the concentration of the active ingredient in the actual product rather than the actual format. The other thing that we see with these different formats where people are maybe drinking it or eating a cookie is that sometimes it'll catch up to them really fast. So they'll like have no effect and then suddenly they'll feel really out of it because sometimes they come to the emergency department and it hits them all of a sudden. So that's sometimes also what happens with the different formats.
I'm curious, even thinking about that in an ER setting, is there a particular format that you see more of people coming in for? Or more the dosage?
No, I would say more it's the dosage. And then we do see sometimes, they look innocuous. So the cookies and the brownies can look very innocuous and sometimes kids get into them. So then the concentration is really high for a child, right? And they can really sort of get in trouble. So I think the main thing is that, they look kind of innocuous. They look like something that's not very dangerous. And people can kind of really get in trouble with them.
Absolutely. And there's a big distinction between medicinal and recreational use. So
Yes.
from a physician's perspective, what are the legitimate medical uses that you support? And where do you see people crossing into territory that is a little concerning for you?
Yeah, so the legitimate uses for marijuana that we've actually seen are things like when people have they're on chemotherapy and they have really bad nausea and vomiting, or they have really poor appetite, and not as problems with weight gain. You can also see it for use with MS when people have a lot of problems with spasticity and shaking. And then for CBD, we have seen that used, medically in seizures, and things along that line. So those are sort of the medical uses for marijuana and CBD.
And and that's in terms of crossing a territory that's concerning. Is there anything specific that stands out? Do you think it's more so if people aren't using it for any of the things you mentioned, it's a little bit of a risky situation?
Yeah, well, I would say this is that we find that like people get into more trouble with marijuana the earlier they start using it.
Mm.
Right? So, I think because people think, oh, it's legal, it's all over the place, it's okay now. And we're seeing a lot of underage usage, right? And that can be really problematic because the brain is still developing then. And your brain is really developing until you turn about 26. So people who use it early and use it frequently are more likely to get like cognitive decline, short-term memory, problems with attention and focus, and sort of kind of executive decision-making functions, that sort of thing. And so yeah, so the early use is very concerning.
And like you said, that's something in the ER that you've been seeing the most as a big issue, or you really like flagged that as one of the bigger issues is kids getting into parents' marijuana or
Yeah.
CBD products. So you mentioned a few things that are issues with younger people using it, but how serious is that problem? And is there anything that comes to mind in terms of what it looks like clinically that you didn't just touch on?
Yeah, so the other thing that we find is that when people use marijuana heavily, they can get cyclic vomiting. We usually see this in people who are like daily marijuana users. And then they'll get like where they just can't stop throwing up, like literally cannot stop throwing up. Sometimes what people do when they're at home is they try to take a really hot shower or a really hot bath because it'll make them feel better. But there's times when we have to bring them into the emergency. They come into the emergency department, and then we have to give them IV hydration, medications to make them stop vomiting, and sometimes admit them overnight. I probably see that the most.
Wow. And
Yeah.
is that what you refer to, or is that what's called cannabinoid hyperemesis? Or am I pronouncing?
Yeah. It's cannabinoid hyperemesis syndrome. We
Okay.
call it cyclic vomiting or hyperemesis syndrome related to cannabis use. And once you actually start getting that, you have to quit. Like
That's very
you can't just cut back and think the symptoms are going to go away. Like once you start developing, cannabinoid hyperemesis syndrome, you have to actually quit.
Yeah, and that's something I feel like is not talked about at all. Most people haven't heard of it. I personally have never heard of it. So do you think you're seeing more and more of that now than compared to before?
Absolutely. I see a ton of it now. And I used to, at the beginning of my practice, I don't even know if it was a thing, right? Like I don't ever remember seeing it when I first started practicing it, but I see it a lot now. We probably easily have patients almost every day that come in with hyperemesis syndrome
Wow.
in one of our emergency departments. Yeah.
Wow, that's shocking. And is it mostly younger people or kids, or is it all ages that you see?
Um, Usually we're seeing it in people that are kind of like in the sort of 20 to 30 age range. Yeah. So it's usually because you have to be using marijuana chronically. So, if someone starts using it underage, they usually don't get to chronic usage until they're in their 20s. Right. And so we see it with people that use it very heavily, like more like 4 times a week, like they're using marijuana 4 times a week or more. They may be daily users. So those are the types of scenarios and situations in which we're seeing it.
Wow, no, that's so interesting. And another concern I know you've raised is early memory problems with overuse, particularly in younger users. So, what are you seeing, and what does the research tell us about long-term cognitive effects?
Yeah. So it really depends upon, again, how early you start using it and how frequently you use it. But so again, it's normally short-term memory problems, you decrease in people's IQ, problems making decisions or sort of executive functions, problem solving. Those sorts of things are sort of what we see. It almost looks like a early on. It would look like to someone who's not in medicine, almost like an early dementia.
Wow. That's so shocking to hear, because
Yes.
it's always been one of those controversial topics where some people were okay with it and some people
Yeah.
were, and now with the growing, normalization of it, it's become so common that you don't even really think about the long-term effects. So it's so important to really be talking about this. And
Yeah.
I think another thing that feeds into that is that there's this perception, because marijuana is natural or now legal in a lot of states, it's essentially kind of a harmless drug. But how do you respond to that? Or how do you feel about that mindset as an ER doctor?
Well, I see that I see marijuana and the effects of marijuana in the emergency department a lot. So I'm very clear that it's not harmless. And so I think that, what you said at the very beginning is just because something's legal and just because something's fully available doesn't mean that you should just indulge no
Right.
matter what, right? And so, I sort of tell people is, look and try to think about, what are you actually, what is it? Why are you actually using it? And what is the benefit that you're actually getting from this? And could you get that benefit some other way? Right.
Mhm.
And I think that, and really, in the emergency department, I mean, we see the effects of not just marijuana, alcohol, cocaine, heroin, all types of chemicals that people actually use. So you just want to think about, well, why am I using this? What is the effect that I'm getting? What is the gratification that I'm getting? And can I get that gratification some other way?
That's such a good way to think about it. Like, I really like that mindset shift of like, what is this giving me and how can I potentially find this from a healthier route? And
Right.
something else you said I wanted to touch on too, about going back to what I said originally about how just because it's legal and everywhere doesn't make it necessarily harmless or okay or not hurtful. Because, not to compare weed to cigarettes, but just on that topic, I mean, cigarettes are still legal and sold in
That's right.
think about, we've had what, I don't know, 40, 50, 60 years or whatever
Yes.
now about how harmful it is, and it's still illegal.
It's still legal.
It's
Right.
it's interesting to think about this conversation like maybe 10 years from now about maybe the effects that it's having now that it's been legalized. It's just an interesting thought that
Yeah.
pops into my head. And going back to CBD also being everywhere now. I mean, there's coffee shops, drugstores, I mean, gas stations everywhere. And it's often marketed as completely safe. But what should consumers actually know about CBD quality and dosing and drug interactions?
So CBD, people use CBD for pain management. CBD can also be used for like anxiety and calming and things like that. Again, all of these products, you want to make sure that you're very clear, if you're using them, what is the concentration of what I'm actually using? Because you can suddenly jump into a new category that has a much higher concentration and be really shocked by what happens. I had a friend of mine who actually, when you were talking about gummies, he ate a gummy and like had to pull over on the side of the road. He was like, "Come get me." I was like, he was like, I thought it was just one gummy. And no, no,
Yeah.
it can be a lot more than you actually think. So I think for a lot of people, especially out here when people are driving, there's a lot of impaired driving. Just like we see impaired driving with alcohol, we see impaired driving with marijuana products. They're going to have a breathalyzer for marijuana that's actually coming to market. So because the police are stopping people and, they may be negative for alcohol, but they're clearly intoxicated for something. And so, we also see that in the emergency department when there's car accidents or accidents that involve pedestrians that may be, high or have recently ingested marijuana or a marijuana product.
And going back to, I'm curious about this because I know we talked about dosage. So do you think it's safe for just a lower dose and people are just maybe taking too much of it at times?
So I think what I normally see in the emergency department is people don't know what they're taking.
Exactly.
It's more of a complete, like, I don't even know what I'm taking.
Exactly. Yeah.
And then they're kind of caught by surprise, right? And so I think, because I don't think people think to necessarily read a label or ask a question, right? And so, yeah, I think that's really important. So I sort of get it more where people just don't even know what they're taking.
Yeah. And it's so interesting too, because this isn't really something I had thought about until this discussion with you. But if you think about it, marijuana, whether it was medicinal or recreational, it wasn't legal before recreationally. So people,
Right.
you really didn't know what you were getting, right?
You
You're
really
probably
didn't know.
off
Yes.
the street or whatnot, right? But now,
Right.
for example, I live in front of a huge dispensary. So I leave my house and I see the dispensary right away. And I think people go in there and they think they know what they're getting, but they don't know particularly maybe about the right dosage or CBD or marijuana or the differences. And they're just saying like, oh, let me get this, or, oh, maybe I like this label or whatever. And maybe just
Right.
not really still understanding what they're taking. I mean, I went into the dispensary to get the CBD gummies for my dog because he
Yeah.
was like, having anxiety. If I put him in a car, he gets super anxious. And I remember I gave him one and it didn't do anything. So I gave him another one and he threw up. And I was like, I felt so bad. I was like, we're not giving you these anymore. But it just made me think of that because you really don't know the dosage and like what exactly is in it.
Yeah. Well, so the other thing is that now, because it's legal in certain states and they're kind of farming it, right? You're getting marijuana with really, really high concentrations of THC because it's being farmed that way, right? And so, it's very different from marijuana that people maybe used in the 60s, right? That was growing out wild. And so, it's a whole different world. And so, I tell people, I really, I know I said it earlier, but I'm gonna say it again. Why? So look at why and see if you can find some other way to get that particular gratification that you're getting from, particularly the marijuana. Do you know what I mean? CBD has less issues because CBD, again, doesn't give you a high. But when you're talking about marijuana, it's like, how can you get that feeling of relaxation or whatever you're trying to get and get it in a safer format?
Absolutely. And for listeners who do choose to use marijuana or CBD recreationally, what does enjoy responsibly actually look like in practice for that scenario?
For me in the emergency department, it's hard for me to actually say what responsible looks like. Because I see so many issues. I'm not sure what enjoy responsibly, uh, I'm not sure what enjoy responsibly actually really, really looks like, to be quite honest. Do you know what I mean? I think, it's interesting. I see everything bad that happens.
Right.
So, you know what I mean? I'm not, and honestly, I would say the same thing. Like, can you really enjoy cigarettes responsibly? No, right? Your cancer risk goes up as soon as you start smoking. So I don't know, for things like that. I don't know if there is a real, enjoy responsibly
Absolutely.
avenue. Yeah.
And it is interesting because you're seeing probably the scariest cases of things because it's emergency.
Right.
It's not even like a checkup and maybe it's emergency. You're seeing the worst case scenarios, I would assume, in a lot of times, a lot of, interaction.
Yeah. Yeah. I mean, I think for those people that, really have side effects related to chemo, really have, a really bad MS and problems with gaining weight and, wasting from whatever disease they're dealing with. I think that, those are folks that can really get some benefit from marijuana. Everybody else, I think, should probably maybe pick something else to do that gives them the same effect.
Exactly. No, for sure. And Is there anything that you think we should be talking about on this topic that the public is missing, whether it's either policy, equity and access, the rise of synthetic cannabinoids, or anything else on your radar from the front lines?
The main thing that I see this from the front lines is make sure the kids don't get into this. Like we've had some really, really scary cases with kids, right? Because usually when they get into it, the parents don't know that they got into it. And then they just come like floppy babies. Do you know what I mean? And so, and then we're looking for everything, right? We're like, well, is there a tumor? Is there an infection? We're kind of going all over the place. And so, I think that the main thing that I would actually tell people is just, if you do purchase, especially some of these products where they wear brownies or cookies and they look enticing or colorful gummies, make sure to keep them away from the kids.
Yeah, and it's so easy especially the way it's marketed, like you said, cookies or gummies or
Yeah.
it's like, of course, the kid is going to reach and want to grab it and have
Right.
some of it. It looks like it's marketed for kids half of the time.
Right,
So
right, exactly, exactly.
really think
Now
about it.
that's a policy that I think we could actually really do something about, is like how to make this stuff more safer so that the kids don't actually get into these things.
Absolutely. And I mean, I don't know off the top of my head, to be honest, like if the packaging says this or not, but if it does, I'm sure it's in fine print. Like it should probably be marketed big on whatever the product is,
Right.
like not for kids' use, because
Yes.
a kid might not intentionally be trying to do something wrong and then, end up in
Right.
because it looks like a cookie. So,
Right. And the same thing I think with underage use, right?
Right.
I think that, people think, oh, since it's legal, I can give it to my 16 or 17-year-old. I think people really need to stay away from underage use. The brain is really still developing, and it's a really important time to protect your brain. And I say that if we're talking about marijuana, if we're talking about, playing football or head injuries, it's really, really important to protect your brain until it's fully developed around 25, 26 years old.
absolutely. And
Yeah.
it is good to hear that it can help, though, medicinally. Like, for example, I mean, I had an aunt with MS, and I think that this was way before marijuana was something that was given to people to help, because this was a really long time ago. But
Right.
it can help if it's used in the right way and medicinally. It's the recreational
Right.
use that's a little scary, right?
Yes, yes. That's where things get sketchy.
Yeah, exactly. And for example, if someone is, maybe not feeling well, or they have chronic pain or anything like that, is that something that they can actually go to the doctor and say, I want this, but to use medicinally, or I'm having pain, maybe this can help? Is that something that is an option, actually?
Yeah. So what happens is there's a whole field of medicine that's related to pain management, right? And what happens with pain management is they actually look at what are some of the non-addictive, non-psychoactive ways to actually deal with your pain, right? And so sometimes it can be lidocaine patches, it can be various prescriptions, and so a pain management clinic will definitely help people with their pain. And if it's in a state where marijuana or CBD is legal. Well, marijuana, I should say, if we're in a state where marijuana is legal, they may then prescribe or actually give recommendations around that. But usually most physicians are going to try a lot of things before they get to that point. Similarly, for the nausea and vomiting, we have a lot of things to try for nausea and vomiting and to get people to get their appetite back. And, we'll try those things before we'll necessarily go to marijuana. Marijuana, legal medicinal use of marijuana is not a frontline agent in really any of the things that we've discussed, right? But I think it is important because if you're using it for medicinal use, you have a lot of other medications that you're taking. You may have more than one disease that you're managing, right? So it's really, really important to get, professional guidance in what you're actually doing.
Absolutely. And I think, like a lot of things in health, this isn't black and white. It sounds like there's a place for both medicinal and recreational use, but the key is definitely awareness and understanding what you're using, how you're using it, and what the real risks are not just the marketed benefits. Because what's normalized isn't always harmless, like we learned about today. And if this episode gave you a clear perspective, I know it definitely gave me a clear perspective. Make sure that you share it with someone who might need it, especially as these products become more and more accessible. And especially what we talked about, if you have friends that are parents or if you're a parent, make sure that they're aware as well. Make sure to send them this episode. And if you want more conversations that stay grounded in reality, not just trends, make sure you are following the show. Make sure you are following What the Health is Happening with Dr. V. I think this was a great episode. And again, make sure you share and send it with someone who can resonate with it. Dr. V, it was great seeing you. This was such a good episode. And I can't wait for our next conversation.
Thank you.
Talk to you soon.
Okay.